for remarks from the speakers and the participants. I would actually start with the conference, welcoming you once again and thanking first and foremost our distinguished guests and speakers for today, and of course each and one of the participants who are joining us from the different corners of Africa and further beyond. I am very pleased to begin this conference. Just let me explain how it's going to work. We have a first institutional address panel with 7 speakers that will address the conference on the topic of a commitment for inclusive social protection. We will then take a 10-minute break, followed by the presentation of the main highlights of the 4 panels that took place yesterday as part of the technical workshop of this conference. And finally, the African Disability Forum will present the call for action for inclusion of persons with disabilities in social protection. So now, with no further ado, I have the pleasure and the honor to introduce His Excellency, the Ambassador Alberto Ucela-Lloret, Ambassador of the Kingdom of Spain to Sudan, for his address. So, Mr. Ambassador, you have the floor. Thank you very much. Muchas gracias.
Thank you very much. Muchas gracias. Excellencies and distinguished colleagues and participants, we are very honored to participate in your policy conference on behalf of the Embassy of Spain here in Sudan. I think the discussions yesterday were very enlightening, and it is very encouraging to see this mobilization of political will and of administrative capacity to promote the rights of persons with disabilities throughout Africa. And for us, for Spain, international cooperation in this field is a priority. Our foreign action strategy for 2020-2024 contemplates the promotion of the rights of persons with disabilities as one of our main priorities in the field of human rights and democracy. And this is, of course, in line with the Crpd and with the European Consensus on Development. 2 weeks ago, I visited 2 refugee camps in Sudan, where the Spanish Red Cross is implementing a project with European Union funding. And I was very happy to see that the criterion that had been chosen to identify vulnerable refugee families was the fact of having one of their members with disabilities and also of having a single mother as their head. So once identified, these families were given vouchers to supplement their food aid and therefore improving their livelihoods. And by the way, I think this is a very good example of something that I think UNICEF highlighted yesterday, which is the importance of targeting households as well as individuals. But these programs are temporary, and they only compensate for a small part of the huge challenges that these refugees with disabilities are facing. And among the Sudanese host community, almost as big. We also went to the historic Aba Island, where the Imam al-Mahdi University hosts a school where a very dedicated group of students with disabilities and their teachers carry out their work with very little resources. So in Sudan, we are now to have a government that is fully committed to good and reform, and specifically to the rights of persons with disabilities. But of course, after 30 years of isolation and neglect, the transitional authorities here in Sudan cannot cover all these needs without help, without cooperation. And the same is true, by the way, of international humanitarian action and development cooperation. Neither can do it alone, neither can work alone. So the question is how together. And as you know, the European Union also funds our project, Bridging the Gap, which is implemented in 5 countries throughout the world by a consortium led by FIAB, by the Spanish Corporation, and that is led here and implemented here in Sudan by our Italian friends. And I think this is a very good example of the spirit of Team Europe that grows stronger every day as we decide as Europeans to face our common challenges together. But one of the initiatives of this of our Italian colleagues in the program, in the project Bridging the Gap, has been to establish a group of friends of persons with disabilities in Sudan that acts as a platform to raise awareness and as a meeting point between the authorities and development partners on all issues pertaining to the rights of persons with disabilities. In our view, the next logical step should be the name of the group of friends here in Sudan in the new donor coordination structure that is now being established in Khartoum. For governments and for development partners, we believe that in this decade of action, it is going to be crucial to our coordination efforts. We must make sure that we can integrate the rights of persons with disabilities in the different government policies, in the different donors, programs and projects. And we need well-organized structures that can allow us to maintain a regular dialogue about this, including follow-up and implementation mechanisms. The group of friends can therefore become a working group that can interact with all the other thematic working groups in the new coordination structure that has been proposed by the special representative of the Secretary General of the Nations here in Sudan. And it can thus multiply its impact along humanitarian development nexus. It can act as a catalyst for an agenda for inclusive development in what has been described as the new Sudanese model. And I think this would be really a huge achievement if we manage to do this. So in this context, I wanted to fully support I'm anticipating a little bit, your call to action as a tool that can help us to incorporate inclusion to the political dialogue that we are going to have with the government of Sudan and with development partners, and to act as a reminder of the priority that we should give to the rights of persons with disabilities in our daily humanitarian and development work. So we will take up the call to action with our partners in the group of friends here in Sudan, and with our government friends and the development partners in order to continue the work that we have started under your project. So thank you very much.
Thank you very much. Muchas gracias, embajador. Thank you for your intervention, for your words, and especially for anticipating your support to the call. This is absolutely brilliant. This is exactly what we were expecting and hoping, and we are delighted to count on your support and on Spain's support in this case. So thank you once again, and now I will move on for the sake of speeding up the agenda and try to cope with the pace we had established. Move on to the second panelist in the agenda. Unfortunately, I think that Mr. Dramana Aidara is not here yet. He was announced as the second speaker, but correct me if I'm wrong, Mr. Aidara, if you're already here. All right, I see he's not here yet, so probably will join us in a few moments. And in the meantime, I will move on to the next speaker, Dr. Aram Topsen, Director General of Social Action at the Ministry of Social Action and Health of Senegal, in representation of Minister Abdoulaye Diouf Sarr, Minister of Social Action and Health of the Republic of Senegal. Dr. Topsen, à vous la parole. Merci beaucoup.
Voilà, merci beaucoup, Monsieur Federico Martyr. Je commencerai par vous transmettre les salutations de Monsieur le ministre Abdoulaye Diouf Sarr, qui est empêché, parce que vous savez, au Sénégal, aujourd'hui, en fait, tous les mercredis, il y a une réunion hebdomadaire du Conseil des ministres. Donc, c'est ça qui fait qu'il n'a pas pu participer à cette rencontre. Moi, je m'appelle, comme vous l'avez dit, Aram Topsen. Donc, je le représente dans, cette grande conférence. Donc, je vais lire ce qu'il avait préparé pour cette conférence. Donc, Monsieur Federico Martyr, directeur du projet européen Bridging the Gap. Madame Irène.
Ms. Irene Mingason, Ambassador of the European Union of Senegal, Ms. Olga Caparza Gomez, Spanish Ambassador of Senegal, Mr. Draman Drara of the ILO Western Africa, even though he hasn't joined us yet, Mr. Idris Maida, President of the African Disability Forum, distinguished guests, ladies, gentlemen. On behalf of the Minister of Social Action and Health, Mr. Abdoulaye Diouf Sarr, it's a great pleasure and an honor for me to be here with you today in this dialogue on social protection in Africa, which is called A New Path Towards Inclusion of Persons with Disabilities. And I would like to thank you for having us on board. And I'm afraid that the COVID context in Senegal has caused us to not be able to organize an international face-to-face conference. And in its place, we are having it online. But we would like to nonetheless thank you for having chosen Senegal to organize this conference. With regards to the general objectives that we have set out for this conference, which is going to focus on dialogue on social protection in order to understand what the best practices in the continent are, we have decided to lay out a series of clear objectives because we consider that to be very relevant. That's to say, to share good practices, to share innovative solutions, and to show our total commitment with the participation of the different disabled people organizations and international donors to propose international solutions. So, ladies and gentlemen, we must recall that the amount of people with disabilities is constantly evolving, and people with disabilities represent more than 1 billion people. That's a very significant percentage of the world population. In Senegal, after the census that was put together in 2013, the population of people with disabilities amounted to 767,000. That's 0.14% of the population. That is 5.9% as a relative value. To a large extent, this is due to the different measures that have been implemented in Senegal to measure disabilities. We have put together a census of disabled people, which is based on, well, actually, we could share with you the tool if you wish to see it. And from the conceptual perspective, disabilities are defined as those situations whereby barriers need to be overcome in order to establish social relationships and with the environment. There's some disabled individuals who are completely neglected in their households. They don't even speak about them because of cultural reasons. And therefore, this is part of the problem that causes it to be very difficult to come up with a specific figure when measuring the population with disabilities. The World Health Organization calls for a multi-sector approach, and this is why we need to conceive and implement in Western Africa an inclusive system of social protection. And this conference is a great opportunity for us to compare the different innovative strategies for the inclusion of people with disabilities in the different social protection systems. Under the umbrella of the improvement of the livelihood of people, a person with disabilities in 2010 has seen the approval of a reference law, which is the framework for for disabilities in our country. And there's 50 provisions there. 15 of them refer to inclusion mechanisms. This new law, which is a social guidance, has caused the Council of Ministers to meet on the 13th of February to come up with a series of inclusive and cross-sectional directives. We have also created a work working party, a working group that met last week from the 22nd to the 25th of March in Dakar. And their purpose was to ascertain what was the status of the application of this law on social guidance in the different sectors, because the social guidance law is a law that promotes the integration of people with disabilities, and this is something that needs to be taken on board by different ministerial sectors. So for the different ministries, we had to ascertain what the status was like with regards to the inclusion of people with disabilities. And right now at SALI, they have an ongoing workshop to do monitoring of the implementation of the different recommendations. And I'm also part of that interministerial board or council. One of the mechanisms laid out by this social guidance law is equal opportunities. This offers services for people with disabilities in terms of social insurance, education, access to the labor market, and access to a healthy livelihood. And therefore, we provide a card for people with disabilities. This is called the Equal Opportunity Card, and it's in a way a recognition that falls under the umbrella of the second phase of the project, together with the African Union for the period 2018-2022, which is part of the African Architecture Project too. And at the end of the period, we will evaluate what the impact of the intervention has been under the framework of this project. And yesterday, in the technical encounter, we talked about the promotion of people with disabilities, and we talked about this card, the Equal Opportunity Card, and we also discussed disability assessments. We briefly talked about the different actions that have been implemented in Senegal in the area of disabilities, the readaptation strategy on a community base, and the approval through a decree. And I would like to say that on that strategy, we have 34 communities that have begun with adaptation programs, and each community tries and assume responsibility in line with its resources over the inclusion of people with disabilities, trying to integrate them in the economic activities of the community as such. Additionally, at this point in time, we have embarked in a new project. We are issuing 70,000 new cards, new equal opportunity cards, and I think that this was mentioned yesterday already, but at any rate, it's something that the Ministry of Social Action and Health also needs to head, even though other ministries will also be on board and will perform different actions to integrate people with disabilities. And all these interventions need to be articulated over the base of this Equal Opportunity Card. The Equal Opportunity Card has a pool linked to it. It has universal disease coverage. It also offers advantages related to passports, etc. Also, at Senegal, we are drafting a report on disabilities in our country, and we are actually examining the situation, and we are also drafting a report on the evolution of the different programs on disability, and this is done through a national plan that was established from 2017 until 2021. We have also announced measures on disabilities, and we have appointed sectoral contact points for the inclusion of people with disabilities together with the African Union. And that's to say, the African Union and Senegal have come up with focus points in each ministry who will be in charge of managing disability. That's to say, each of these focus points or contact points will be in charge of performing the monitoring of the evolution of the programs for people with disabilities. And for me, this shows that we have a fertile ground so that we can continue to obtain further advances in the field of disabilities, working hand in hand with other partners and development and cooperation associations. I would like to thank you all for your kind attention. Thank you so very much. And as we say in Senegal, dear Jeff. Thank you very much, Doctor. Thank you very much for your kind words. And thank you very much to the Minister who gave you the possibility of representing him to explain to us what the progress has been like and the achievements obtained by Senegal. It's very important for us to have your contributions. And also, this is something that we can add to the presentation that we had yesterday.
Next speaker of this conference, Madam Getty Oforiwa-Fefuamen. I hope I've pronounced it correctly. If not, I apologize. Member of the UN Committee on the Rights of Persons with Disabilities. Madam, the floor is yours. Thank you very much.
Thank you very much, moderator. Moderator, distinguished ministers, partners, all protocol observed. I am Getty Oforiwa-Fefuamen, a member of the UN Committee of Experts on the Rights of Persons with Disabilities. I work with Site Savers as a global social inclusion advisor responsible for social inclusion, and I come from Ghana. Thank you once more for the opportunity. My brief presentation will briefly bring us back to the pillars of social protection, the situation of persons with disabilities, the gaps that are observed, how we address these gaps so that we can achieve it, and we'll conclude with contributions by the Crpd committee. As we all may know already, the pillars include all the formal and informal initiatives that provide social assistance and services to extremely poor. And these include individuals and households, and they need specific care or otherwise be denied of access to basic services. And that's where I'm emphasizing denial of access to basic services. All African leaders, service providers, and citizenry will need to agree that any intervention that is not disability inclusive will leave persons with disabilities farther behind because they are part of those who are denied. We are often denied. Evidence shows that persons with disabilities are more likely to live in poor households, less access to education, health access, including that of reproductive and social health. They are also more unlikely to be employed due to barriers, stigma, and discrimination. And consequently, have very low incomes. The situation is worse for women, girls, other persons, and those among us who require more support. Unfortunately, most of the times, social protection schemes provided to ensure basic income security to persons with low income exclude those of us with disability, particularly those who receive disability allowance. Particularly those are also granted on disability status. And then we are denying the fact that it does not take account the income of the person and or the person's household situation. So in this way, it is confusing to practitioners why they put the two functions of social protection. And therefore, it has to be that social protection has to be looked at in the view of the poverty alleviation scheme and also the disability-related issues. What needs to be done? Social protection schemes need to support and promote the inclusion of persons with disabilities in all the areas identified above, and in employment in particular. It must ensure adequate standard of living. It is important that to very clearly distinguish the function of social protection, as I said earlier, for persons with disabilities from the function of the disability-related issues. So firstly, we need to ensure that the basic income is well noted and it provides security. Second, it should ensure, emphasizing, the compensation of the disability-related costs. So for instance, I am a person with visual impairment. In fact, I'm totally blind. And so if I'm in a poverty household and I'm only looked at for my poverty-related issue and the limitation it brings to my being visually impaired, the assistance I require, the assistive devices I require, and all those interventions are not taken care of, then I am not operating on an equal basis with others, and I'm not going to enjoy equal rights at all. So we need to put an end to this confusion. Persons with disabilities need to include it in basic income security programs and also be granted with social protection schemes that contribute to cover disability-related costs. Like the example I gave, it can be in cash or in kind. And this must be a priority in order to be in line of the CRPD. One thing that I wish to draw attention is assessment of disability. It has to be based on the human rights model, meaning that it should focus on the existing barriers of the environment and the support required by persons with disabilities to participate in social life. And this is what will bring us to be on equal basis with others. We need to reflect on how to simplify and reshape disability assessment processes so that they are not burdensome and expensive for the state, and should be simple and free for the person, and also accessible at the same time. It must be reliable and comprehensive, and it must address the barriers and support needs that we are talking about. Furthermore, they should be unified through the territory of each country. So not that people in the South are getting more from people in the South, in the North, please. And it has to adapt to local specifications. It is important that data obtained through disability assessment systems should not only inform the eligibility criteria, but it has also to play importance policy planning and case management, in the social protection programs, and also for policy planning of other areas of development. So case management systems in data produce can be used in developing programs to address and respond to the impact of COVID as an example, and its impact on persons with disabilities. And also such as identified persons with disabilities who are in need for support services or for urgent vaccination. We can go on and on and on. The right to social protection is closely interrelated to the right to health and serves as a means to ensure that states should therefore improve the implementation of both. Let us look at the contribution of the CRPD as I'm trying to finalize. The timeliness of this event cannot be overemphasized because in connection with the CRPD, it links up to the process for which is going on of the general comment on Article 27 on work and employment. And for that context, the CRPD committee will continue to reject concepts like incapacity to work or fitness to work, etc., that excludes persons with disabilities from economic activities. I'm glad that this event happened, and I am eager to receive more information on this topic. I commit to do my best to move conversation on social protection within the committee in order to tighten and improve our jurisdiction by being more conceptually precise and concrete for state parties to be able to implement actions on the ground. I would also like to use this opportunity to recognize the contribution of Peter Sunday Omelagbe Amuzi. I hope I've got it right. Member of the UN Committee on Social Protection and the Right, who is an ally in this regard. Thank you so much for your audience. Thank you again.
Thank you very much, Getty, for your words, for bringing in your expertise as UNCRPD committee member. It was very important, of course, to provide also this angle into the discussion of this conference. And so again, thank you on behalf of everybody for your words and your commitment to the inclusion of persons with disabilities, in particular in the field of social protection. So now I will move, this time not up in the agenda, but back in the agenda. I see that Mr. Draman Aidara, from Director of ILO West Africa, has joined us, and I thank him wholeheartedly for joining us this morning. With no further ado, I will leave him the floor to address the conference. Mr. Draman, please, the floor is yours. Thank you very much for joining us.
Merci beaucoup. Désolé pour le retard. Je pense qu'avec le décalage horaire.
Thank you very much. My apologies for the delay, maybe because of the time zone difference. Unfortunately, there was confusion. The Minister on Social Action and Health and their representatives, the representatives of the Spanish Kingdom in Senegal, General Director, Deputy Regional Director of UNICEF for ESARO, dear President of the African Disability Forum, ladies and gentlemen. To me, it is a great honor to address you this morning in this conference on the social protection policy, inclusive social protection policies in Africa. I would like to send out a call to action, as the African Forum for Development has done, so that we can develop inclusive social protection schemes. We know that persons with disability face several obstacles to be able to participate in society throughout their lifetime. It is very important to take into consideration persons with disability, given the fact that they can very often not take full part on social and economic life. Even in the case of crisis, like the crisis of the COVID-19, this worsens. They are the ones that are most susceptible to lose their job, and they will face more difficulties to find a new job. The ILO, talking about the efficient coverage, explains that only 33% of the persons with severe disability in the whole world receive a disability allowance. And the situation is more concerning in Africa because this level of protection only reaches 8.5% of their population, and inequalities in relation with disability was very important prior to the COVID-19 crisis. So we see that less than 8% of the population are enjoying social protection benefits, especially now after this pandemic crisis. And we have to do as much as we can so that these inequalities do not worsen during the crisis. And although the ILO also adopts an approach based on the life cycle of the person in their social protection schemes, I would like to concentrate my intervention today in the aspects that affect adult persons with disability, because as it has been said by UNICEF, this has been covered by them, and now we want to concentrate on adults. We want to have an inclusive social protection system facilitating their connection with business people so that they can provide inclusive integration to the labor market and better social protection. But we know that this social protection needs to be supported in order to cover the disability-related cost, their health cost, and the cost of the assistive devices. Otherwise, persons with disabilities will not be able to fully enjoy the economic opportunities in their societies. They will continue on being vulnerable, as we've seen with the COVID-19 crisis. We're fully convinced that social protection is an indispensable complement with an active and inclusive policy for their insertion in the labor market. We also know that there are many elder people who live with a disability, and therefore they need some social support through supplementary allowances of benefits and long-term care and other services according to their needs. As we indicate in our call to action, ILO supports the different countries so that they can have an adapted solutions for disabled people, and they support them in the provision of services so that they can face the disabled-related cost and the difficulties faced by persons with disability. This will lead to the adoption and the progressive rollout of non-universal benefits for persons with disability that are compatible with the insertion in the labor market, as is happening in Libya and as is happening in Mauritius Island. This will require the provision of other services and extending their access to healthcare services and also assistive devices. In that sense, the Equal Opportunity Card is a program that was established in Senegal some years ago, and it was a new approach to help persons with disabilities so that they can get full access to social services. And it has been done together with the government. We know that there are many challenges in the region, budgetary challenges with a very limited budget, and that makes us being more consistent between social protection and labor policies. And we need to have a very inclusive approach to all social protection schemes. Also, we need to set up systems for training on disability so that it can help in the planning of policies and the efficient distribution of resources. Also, I want to say that with regards to social protection at the ILO, we have different approaches. On one hand, we need to know that this social protection has to be done with an inclusive approach. We have to do different studies on the labor market, the active population, and the disabled people so that we can come up with a system that will help us to build an inclusive social protection system that will help to integrate in the labor market persons with disability, and that will help us to measure the progress that we made in all of the countries. But data is not enough. We need to get the information from the disabled people themselves. We need to include them in the dialogue to reform and extend social protection systems so that we guarantee that they are fully included, that their needs are taken into consideration. And we are available to work with all of the stakeholders so that by 2030, all the persons with disabilities will obtain the necessary support for the participation in equal opportunities in societies. Thank you very much for your kind attention. That was all that I had to say. Thank you very much. Thank you very much. Deputy Regional, Director of the ILO Western Africa, for your words and these call to actions. We are happy to have the support of the ILO. We've had that support for many years. They have been engaged in social protection for many years, and so thank you again on my behalf, and thank you very much for reminding of the participants of some of the best practices that are carried out in Africa that were discussed yesterday in the technical seminar, but it is important to highlight them today to continue on advancing in this topic and in the context of the social inclusion of the persons with disabilities. Thank you very much. Do not worry about the delay. It was no problem, and thank you very much for joining us. Thank you.
Agenda, so I would like to move on to the next one, Mr. Peter Sunday Omologbe Muse. Hope again I have pronounced correctly, otherwise my apologies. Member of the UN Committee on Social, Economic and Cultural Rights. Mr. Muse, you have the floor. Thank you very much. Mr. Muse, can you hear me? Okay, I take it as a no, so there may be perhaps some, I see he's online in the panelists list, but he may have some connection issues, so we'll try to get back to him. And I'll now move on to the next speaker, then Ms. Lieke van der Wiel, UNICEF Deputy Regional Director for Isaro region. Ms. Lieke van der Wiel, you have the floor. Thank you very much for joining us.
Thank you very much, Mr. Chair. Well, I'm delighted to be with you on the second day after already so many positive deliberations and also hearing the other panelists. So on that note, the Honorable Ambassador of Kingdom of Spain to the Republic of Sudan, the representative of the Minister of Social Action, Health, Republic of Senegal, the Director of the ILO in Western Africa, President of the African Disability Forum, and the committee members of the UN Committee on the Rights of the Person with Disabilities that we just heard, and the UN Committee of Social, Economic and Cultural Rights. Colleagues and friends, that's a lot of people to address in such an important gathering. Of course, for us as UNICEF, we're just delighted to be here, not only in this particular protocol event, but throughout the deliberations yesterday, where we could participate with all of you and discuss and think about some of the issues that are really close to our heart, which is the right of the child and especially the most vulnerable children. For us, our commitment towards inclusive social protection on the continent is 100%. It's one way we feel as UNICEF a strategy that really will cover all the children that need support and cover them in a structural, sustained and dignified manner. It's a way for African children on the continent to really improve their lives in a predictable and positive way. Now, currently, and I think many of our colleagues already referred to the situation we're in because of COVID and other issues that we have faced in 2020. But currently, the children currently in the sub-Saharan Africa, they have faced many severe and simultaneous challenges. And unfortunately, I have to say that around 4 out of every 5 children are dealing with daily hardship currently as multidimensional poverty. And that is a very hard start of life. Half living households, half of the household, they really consume below the minimum standards according to the national data. And again, this is a very tough situation for children who not only need to see themselves nourished and protected, but also to see themselves grow, to really reach their full potential. Of course, besides the droughts and cyclone, locust devastation, conflict that remains on the continent, COVID-19 definitely has impacted not only the lives of people with COVID, but secondary impact has been tremendous for our children. They have seen their schools closed. They have seen their parents not being able to work and get food on the table. They have seen their nutrition programs interrupted. And unfortunately, they also have seen an increase in violence, both in household settings as in other settings. And the protective environment has been reduced. And that is something that is really something that we as an international community and a community overall defending the rights of the children need to be working on together. But of course, in addition to the children's situation, we are in particular very concerned about the children that tend to fall between the cracks, that don't have the same profile as other children, and that actually need an extra hand reaching out to them to be able to reach them and to make sure that they do access all the services they deserve and right to have. And these are actually the children with disability. It's in any scenario, those children are not necessarily being reached all the time in a structural manner. If they're being reached, it tends to be in a haphazard way and maybe with education, but not with food or the other way around. And for us, it's very important that we have a concerted effort reaching those children, especially in those difficult circumstances right now. We are building on our relationship with all of the governments across the continent, our partners, amongst others yourselves, and all the other stakeholders in building this social protection system. Of course, over the many years, discussion about social protection and the positive results of having sustained, predictable and structural social protection support for the most vulnerable families, they have taken place, and we have lots of lessons learned that we can build on. 2020, however, really has shown us a very clear picture of what happens if we don't have such a structural social protection system in place, and you really lose families going under the poverty line, not being able to fulfill their most basic needs, negative repercussions to the children. And again, of course, the most vulnerable children, especially disabled children, will feel the brunt of a lack of that social network and a social protection system. On that note, what is it then that can we do making use of the current learning, the current realization, and increased commitment on the social protection and children with disability? We don't have much data, and I think many colleagues earlier on have referred to the lack of data. However, we do know that there are a number of disabled children that are not being, a large number that are not being reached right now. So we would definitely say, okay, now with this increased commitment and opening for all of us to do something and apply our commitment to social protection, is let's see how many children we need to reach and how we can best reach them. So the better data to really connect the disabled children and the families with better adjusted services is absolutely a first step that we need to undertake altogether. And these are, of course, different types of data, different channels, but we do need to work together on that because otherwise we will never have a sufficient picture to approach the issue in a structural manner. Then the gaps in services, of course, is another issue that we need to consider. So once we have found a better picture of the needs of the disabled children, the numbers and the type of services they need, we really need to make sure that the social protection systems are actually offering the appropriate support. So we really need to identify the disability and have assessment tools. We really need to consider when we set up a system or extend social protection system that we have a disability related cost calculated and really link it directly to the benefit levels to make it worthwhile and to really make that added value that we're all looking for. In addition, and that I will elaborate a little bit more, but in addition, we really need to ensure that we have a strengthened case management and that we consequently have an outreach to persons with disability. When I said earlier on that we know through many years that children and families with disabled children are actually falling between the cracks and are so vulnerable, it's because the outreach to really reach them, to make sure that they come forward, that they know there are systems that they have to and can apply for. That outreach really needs a lot of attention, because if we don't manage to reach them and show that there is some assistance and services that they can make use of, then this disparity and the disconnect will remain an issue that we need to tackle over the years to make this dent that we're looking for. For that, we are really convinced, and I think you discussed this at length yesterday, that the cash plus intervention is the way to go. It has proven to be very useful, especially if done in a predictable, sustained manner, and therefore, and I think the ambassador of Spain to Sudan mentioned that it should not be a punctual, humanitarian project with a definite time span, but it really should be a structural approach with predictability and sufficient investment. So we can actually have the cash plus interventions not only support the disabled person and their families, but link them to the other services that they have a right to: education, the family care, the early childhood development, which we know is a tremendous important investment for children with disability. And then, of course, we have some other issues that come up like the provision of assistive devices and technology. And in UNICEF, a very important component is the prevention of institutionalization, which is really an absolute resort that we want to avoid. So we are, as UNICEF, very much aiming to maximize the impact of cash transfers for children with disabilities and their families by having this overarching and holistic approach, together, of course, with the government and other stakeholders. We are convinced that the universal benefits for children in general are really one of the best tools, strategies to achieve other rights, but also a right in itself to have the social protections for children and to make sure that they are able to develop to their fullest potential and are able to really be protected for any other shocks or triggers that might risk them falling under the multidimensional poverty or not being able to access some of those very important rights that we just mentioned, not the least the right to education, which is again with the COVID impact a right that can't be taken for granted. Now, many of you did mention the call to action, and I can't stop here by also referring to the call for action. We are very motivated, committed, and privileged to be able to join hands. And we are delighted to continue this discussion, both at the technical and a commitment level in the near and far future. Thank you very much.
Thank you very much, Madam Deputy Director. A pleasure to hearing from you and also for your engagement and commitment to the call for action and UNICEF says, of course. Thank you also for bringing in the topic, of course, of children with disability, which is of utmost importance. And I think you very well highlighted some of the key aspects. And in particular, I would like to highlight further the importance of the outreach right now, especially now that the COVID situation has further exacerbated the marginalization of children with disabilities. It is important to reach out families and children with disability themselves so that their needs can be addressed and their rights be respected. So thank you very much for bringing this to the table alongside all the other topics that you have mentioned. Thank you for your time once again, Madam Deputy Director, an honor to having you with us. And now we are approaching the end of this session of the conference. We will still have two great speakers to go. I'll try to connect again with Mr. Peter Muse. I think that you can now hear us and you can address the participant with your intervention. Can you hear us, Mr. Muse?
Very clearly, yes, thank you.
Fantastic. So please feel free to turn your camera on and I leave you the floor. Thank you very much.
Okay, let me start without wasting too much time. First, I want to apologize for the little technical hitch. Actually thought I was supposed to speak at 10:30, so that's why I wasn't really available at that time. But nevertheless, I'm here and I hope you can hear me.
Yes, very clear.
Oh, very good then. Well, let me start by thanking the organizers for their initiative of this policy dialogue conference, in particular the IDA, the UNPRPD, the UNICEF, the ILO, the AD, Bridging the Gap, and lastly, its financiers, the European Union. I also join in commending the CSOs and NGOs and all other participants who contributed to yesterday's session. The topic or theme of this policy dialogue conference couldn't have come at a better time than now, when indeed the world is seized with the COVID-19 pandemic and the resources and commitment of the global community and indeed African countries are stressed beyond the limit. In a continent characterized by poverty, drought, diseases, and mismanagement of funds, the need for social protection cannot be overemphasized, particularly given that in the past, and even currently, that the social protection agenda has been donor-driven. I must say that social protection occupies a primacy in the working method of the committee I belong to in the UN, and that's the Committee on Economic, Social, and Cultural Rights. It's that committee, in one of its general statements or comments, recommended the establishment of a special protection floor guaranteeing legal entitlements to individuals as an initial element to be progressively developed into a universal and comprehensive social security system, but in full compliance with Article 9 of its covenant. But I must say that, however, there are many thoughts and declarations on social protection, and I will mention a few due to the time element of this presentation. According to the ILO, Africa is a continent where the coverage of social security is the lowest, and this is due to a clear deficit between social security needs and the capacity to meet these needs. A UNDP study also concludes that with any government-led socioeconomic intervention, sustainability is a critical issue that needs to be carefully integrated into any social protection program. It knows that if this is not done, there is a high risk that this program will become unpopular with certain stakeholders, or that they will be stopped before achieving their objectives. There is also the Yaoundé Tripartite Declaration on the implementation of the social protection floor of 6 to 8 October 2010, consisting of 47 countries of the ILO, to the second African Decent Works Symposium held in Yaoundé. That conference adopted by the tripartite constituents of the ILO. And according to the ILO report, Africa remains a continent where a large proportion of its population does not have access to health care. And there's high infant mortality, and that's where high infant mortality is highest. The report goes on to say that it is a continent with the lowest coverage of social security, and healthcare constitutes the most pressing challenges for social protection. That report also mentions, for instance, that in Senegal and Kenya, since there is no adequate health insurance, 45% of total health expenditure is paid out of pocket. This method has often led to major poverty risks, both for individuals and families. There is also the issue of an aging population and life expectancy in HIV-infected countries in Southern Africa, such as Lesotho, Botswana, and Swaziland, now called Eswatini. Besides this, only a small proportion has access to an old age disability and survival pension. In countries such as Burkina Faso, Ghana, and Senegal, the implication of all this is that a small minority of workers are in the formal, while a larger part is in the informal economy. There is also a UN study report in 2014 on social protection in Africa, which says that finding ways to improve fiscal sustainability is essential. And one way, I quote, is to increase gross domestic product, which will stimulate job creation, reduce poverty, and provide the need for social protection, unquote. However, UN figures indicate that there are currently over 600 million persons with disabilities globally, and out of whom 400 million live in developing countries, and 80 million in Africa. The World Health Organization also states that 40% of Africa's population consists of people with disabilities, including 10 to 15% who have school-age children. There are many reasons to explain the causes of these numbers, and they include malnutrition and disease, environmental hazards, traffic, industrial accidents, civil conflict, and war. But nevertheless, it is pleasing to note that African governments and NGOs under the umbrella of the African Union have taken a bold move to address the disability problem in Africa before. This is due to pressures exerted by disabled persons organizations, which led to the proclamation of the African Decade of Disabled Persons from 2000 to 2009 at its Assembly of Heads of State and Government in Lomé in 2000. The aim of the decade was to promote awareness and commitment to full participation, equality, and empowerment of persons with disabilities in Africa. In addition, a plan of action was also adopted at the Pan-African Conference on the African Decade of Disabled Persons in February 2002. With regards to specific objectives in sharing interesting practices and experience in inclusive social protection in several African countries, the main instrument is the Yaoundé Tripartite Declaration on the implementation of the social protection floor of 6 to 8 October 2010. That conference consisted of 47 African countries of the ILO to the Second African Descent Walk, which symposium was held in Yaoundé. It's interesting to note that the ILO report indicated that Africa remains the continent where a large proportion of its population does not have access to health care. And it's also where infant mortality is highest. In short, it is a continent with the lowest coverage of social security, and healthcare constitutes the most pressing challenges for social protection, and where a small minority has access to old age, disability, and survivor pension. However, there have been some efforts made since then at the level of its continental organization to address these issues. In 2018, the African Union, at its started ordinary session, adopted the protocol to the African Charter on Human and People's Rights of persons with disabilities in Africa, given that those persons with disability experience extreme levels of poverty, social exclusion, and systemic discrimination, among others. The protocol provided a substantive, binding African normative and institutional framework for ensuring, protecting, and promoting the rights of persons with disabilities. Excuse me. The cheering news about the protocol is its provision in Article 34, which has an implementation mechanism that state parties are expected to establish or designate national mechanisms, including independent national institutions, to monitor the implementation of the rights of persons with disability. But despite this landmark protocol, Sub-Saharan Africa is still far from distributing disability benefits, since in the first place, people with disability are still marginalized because of a lack of policy or poor management of inclusive social protection. Excuse me. Disabled people still suffer from lack of health care, education, and employment. It's my belief that social protection must also address the issue of health care, which is a big and pressing challenge in Africa. A comprehensive health insurance system will go a long way in addressing this social need that many people face. In most African countries, except for policies covered by employers, that is government or private organizations. The reality check is that if a vast majority of the populace are expected to pay for these services, it may lead to poverty, particularly if they have to draw on their savings for these expenditures or go into debt. It therefore goes without saying that those who will be hard hit are people with disabilities and who have no income. But there is hope. And in this hope, I use the opportunity to call for a considerable percentage of recovered illicit funds stashed by some African leaders and stored in foreign banks to be used to support people with disabilities in their respective countries. I thank you very much for listening. Thank you.
Thank you very much, Mr. Emuse, for your intervention. I think that the data and information you have provided clearly state the importance of comprehensive, multifaceted insurance and social protection systems in Africa. There's very little to add to what you had said. It was very interesting and comprehensive, and it proved furthermore the importance of this topic, especially addressing the social inclusion of persons with disabilities. So thank you very much for your time today and for your intervention. Before we move to the final speaker, the last but not least speaker, of course, of this panel, just let me thank all the participants who have been writing questions and addressing questions in either the chat box or the Q&A box. Unfortunately, we will not be able to address these questions during the conference, but we will collect them in written format, and we'll hopefully get back to you in writing once the report of this conference will be completed. So thank you very much for your interest, for your very spot-on questions. We will try to get back to you with the help of our panelists. And I switch now to French. Je passe maintenant au français pour introduire le dernier.
I would like to now speak French so that we can give the floor to our last speaker in this conference, Mr. Idriss Maïga, President of the African Disability Forum. Mr. Maïga, you have the floor. Thank you very much. Señor Maïga, ¿me oye? Mr. Maïga, can you hear me?
Monsieur le Président, merci beaucoup.
Merci beaucoup, Federico. Bonjour à tous. Monsieur le représentant des corps diplomatiques.
Thank you very much, Federico, and good morning, everybody. Dear representatives of diplomatic bodies, dear representatives of technical and financial institutions, dear representatives of national and international NGOs, ladies, gentlemen, representatives of organizations of people with disabilities, distinguished guests, ladies, gentlemen. It is an honor for me to take the floor here today to wish you all, well, actually, to thank you all for being here at this virtual conference. There was no other way to go about this due to the health crisis, but I would like to thank you all for having devoted your precious time to this event. I would like to express my gratitude for your presence. Ladies and gentlemen, it's worth recalling that in line with the World Bank reports and the WHO reports, people with disability amount to 2 billion. That is 15% of the world population, roughly. Those reports also highlight that 80% of those disabled people live in developing countries. That is to say that they are most present in poorer countries. And in the poorest countries, people with disabilities are the poorest amongst the poor. And it's not just the issue of poverty, an issue of poverty which is already problematic per se, but also disabled individuals need to face a specific series of challenges and discrimination, lack of employment, lack of support by their governments at their own countries, and this becomes even more severe in the face of the health crisis that unfortunately has found a way into our lives. And this is not something that has made the lives of disabled people easier. And given this context, we consider relevant to speak to organizations that support us and to our governments so that they can take action about this. And precisely because of this, it's been a pleasure for us to be on board in this conference. We are delighted to be co-organizers of this conference. We need to state that the COVID-19 pandemic has had social and economic impacts that have made the hardship of disabled people even more severe. Disabled people are more exposed to the crisis precisely because of the lack of inclusive response. Our governments, or some governments, have tried to respond to the pandemic, but they forgot about the fact that the response had to be inclusive. Furthermore, disabled people are susceptible to losing their job position, and it's even more difficult for them to go back to their positions compared to those who don't have disabilities. Social protection is essential at all times for disabled individuals because it plays a very relevant role. It allows us to offer supports, to access support services, education. It allows us to have access to several elements that can enhance our social and economic status and provide us access to the healthcare system, such as, for instance, rehabilitation and technical aid. African countries have started to implement a series of actions to fight against the economic impact of COVID. For instance, food aid and many other measures that have been mentioned by previous speakers. And all these measures have already been adequately addressed by previous speakers, such as, for instance, employment support, extending social protection programs. But these measures shall always adequately include disabled people and bear in mind non-discrimination and provide access to these measures for people with disabilities, offering an adequate coverage in order for us to enjoy the support measures, the relief measures, and that should result in social intervention programs that should empower disabled people and foster the inclusion of disabled individuals over their lifetime. We wanted to share our knowledge and our expertise in this conference, and we also wanted to reinforce cooperation and restate our commitment to help one another so that we can achieve an effective inclusion of disabled individuals in the social systems. These are just a few reflections that I wanted to share with you, some of the main takeaways that we noted from the different presenters. We are going to continue to fight so that we can overcome this stage that we are in. We want to go beyond oral exchange. We want to go beyond words. We want to be able to materialize all these words on site. People in their day-to-day need to see the effect of these words, of these exchanges. This is why we would wish for the years, the days after these encounters become years in which people with disabilities can look up and say, our partners, our friends have taken action, and that change has become a reality in our day-to-day. So thank you very much to everyone here. These are the words that I wanted to share with you. And this is just a brief introduction to our concerns. Thank you very much.
Thank you very much. Dear President of the African Disability Forum, thank you very much for your kind words. I just have to finish by thanking you and the African Disability Forum for the excellent work that you have done and for your contribution to this conference. Well, not only to this conference, of course, but this conference has allowed us to work so that we can bring about this initiative and we can see some outcomes of it. So thank you very much for this call to action. So I go back to English now.
First session of the conference by sincerely extend my most sincere thank you to all the panelists, all the speakers that have intervened and have taken the time to be with us today. It has been an absolute delight and honor to listen to all our distinguished guests, and I'm sure that all the participants have enjoyed their interventions and contributions. Thank you in particular for the support to the call for action that will be presented at the end of the session, at the end of the conference. Apologies. So we can now move on to a 10-minute break as foreseen in the agenda. We are lagging a little bit behind schedule, but not too much, not as much as we could have expected. So let's have this 10-minute break. Let's be back in 10 minutes sharp, and we move on with the presentation of the main results of yesterday technical workshops panels, and then with the presentation of the call for action. Thank you again to all the speakers and guests, a true honor, and see you in 10 minutes. Okay, okay, let's wait for the international sign language interpreters to be back. In the meantime, I see Mark now connecting. Welcome back. Thank you very much.
Yes. Okay. Yes. Sorry. Please. Sorry, Mr. Hoffman. Can you remind me? You told me your name before, but it's not here. So
So can just somebody switch off Mr. Ambassador's microphone? Mr. Ambassador, don't know if you were talking to me or to somebody else, but your microphone is still on. So, okay, great. Thank you. Yes, well, thank you for being back with us. We move on to the second part of the conference. We have a short session now on presenting the main highlights of yesterday technical workshop addressed aimed at addressing the same topic as today, of course, which is the inclusion of persons with disabilities in social protection systems in Africa. The conference, the technical workshop was structured in 4 panels, and each panel was assigned a moderator and a rapporteur who will now address this conference to present the main results in a very short couple of minutes. So I would ask now the first rapporteur of panel number 1, Director ADF Executive Director Schwab Schalken, to briefly present the main results of panel discussion number 1, from disability assessment to policy planning and case management. And in the meanwhile, I already asked Ms. Alessia Rogai to start her engines for presenting the results of panel discussion number 2. Thank you, and Director, I leave you the floor. Thank you.
Thank you very much. I noted your very few minutes, so I'll be very brief. So our panel was titled From Disability Assessment to Policy Planning. The introduction was done by Mr. Ayasu Komivi from Togo, and he stressed the following points: that disability assessment to obtain disability status should not be based on the medical approach, rather it should be based on functional difficulty and support needed. He also said that the disability assessment process should be simple, accessible, reliable, and unified throughout the country. The data that's gathered from this disability assessment should be used for eligibility criteria, as well as for policy planning, budget planning, and case management. And this gathered data would also be extremely useful during crises such as the COVID-19 crisis or other crises, when it will be easy to use this data to identify the persons with disabilities and their required support. And to achieve the above mentioned purposes, we need to have well-developed systems that is digitalized database system integrated into the national registry system. And the disability assessment process should not reinforce the stigma that is related to disability. There were 2 other speakers, and they presented some of the good practices in Africa. I will start with Rwanda. They are starting to have a digital database system. It is called the Disability Management Information System. And all information that has been obtained from this disability assessment process is used for policy planning and case management. In Senegal, they have a disability card system, which is called the Equal Opportunity Card. This card is given its name in order to promote disability equality and not to reinforce the stigma. And these good practices should be shared among African countries to be studied, reviewed, and implemented according to the specific context. Thank you very much. That completes my report.
Thank you, Director. Since we're a little bit late, I'll move on straight to Alessia for the presentation of the highlights of panel 2. Alessia.
Thank you very much. Good morning to everyone. Yesterday, I had the pleasure to moderate the session, Social Protection and Income Support. It was very interesting seeing how things are moving on. Also, as Alex Coate remarked yesterday at the end of the session, the work is just started, but there is a huge difference in terms of approaches compared to 10 years ago. And I think that is the case of the 3 examples shared yesterday during the second panel. Indeed, in Namibia, there is a very strong example about its comprehensive life cycle social protection system. Daniel Trum from the National Federation of Persons with Disabilities explained about different kind of support that the system includes, such as the basic grants for persons with disabilities, special maintenance grants for children with disabilities, and financial support for students with and without disabilities. The system also includes, for example, free health care in public hospital or coverage of some assistive devices. Another interesting example on how supporting inclusive social protection system has been shared by Fatma Wagare from Inclusion Africa in Kenya. Fatma explained about the successful collaboration between the government and the organization of persons with disabilities to reinforce the system, the social protection system in response to the COVID-19 pandemic and to make it more inclusive. The collaboration between social welfare officers and the organization of persons with disabilities and local administration indeed led to the strengthening of the social protection system to respond to the emergency and support the most vulnerable groups with, for example, short-term cash transfers. We will never be exhausted indeed to repeat it, but example from Kenya highlights not only the successful result of this collaboration, but also the absolute indispensability of the involvement of the organization of persons with disability in the construction of strategies and action that affect them, and their participation in planning social protection schemes. The third example shared at the session was on how the World Food Programme in Ethiopia reinforced disability mainstreaming in its operations. Sarah Solomon showed us the main 3 pillars of the World Food Programme work plan for disability inclusion that pivots on leadership and collaboration with organizational persons with disabilities, the incorporation of the disability component in project and programs, and the work on capacity building with staff partners and government counterparts. So again, very important is the collaboration among different actors at different level. And this is also the kind of collaboration that Bridging the Gap supported at country level in Ethiopia and also in the collaboration with the WFP. Concluding, what really emerged, I think, from this second panel is that surely it cannot be only a single actor to push alone for change, but there must be a will and shared work, and above all, built by all the actors involved in the system. And the example, I repeat, of Kenya on that is very interesting, and the collaboration between the welfare officers, OPDs, and local administration was able to strengthen the social protection system to respond to the COVID-19. Therefore, it means in a relatively short time. So this should make us also reflect on that. Well, thanks once again to the panelists that feed the second panel yesterday, and of course, thanks to the guests and the audience today.
Thank you, Alessia. Thank you very much. Now, I'm taking place of Ms. Judith Ekaete, who was supposed to be the moderator for panel number 3 yesterday on inclusive healthcare and social protection at a crossroad. Unfortunately, she had some connection issues that did not allow her to follow the session. So I'm trying to provide you with some elements of yesterday's discussion that included only 2 panelists. Again, for some technical issues, our colleague Aruna Kafando from Burkina Faso could not deliver his presentation. The first intervention was from Jalil Odom, National Coordinator for Inclusion Ghana, who presented 3 specific initiatives carried on in her country: the LEAP program, Livelihood Empowerment Against Poverty, basically a cash transfer for poorest household in Ghana that targets, however, only persons with severe disabilities. Then coupled by the NHIS, a more comprehensive system launched in 2003, having a more general perspective that, however, did not address the specific needs of persons with disabilities. Eventually, Ms. Jalila presented the so-called DACF, the District Assembly Common Fund, a cash transfer social insurance program targeted at the social and economic development of persons with disability, which bottom line consists of a 3% allocation from central government to districts, which is not at a universal level, as it does not address persons with disabilities in having a good financial standards. It also, Ms. Jadid also reminded that these DACF rely on database which are considerably weak or need to be reinforced nonetheless in order to outreach all persons with disabilities needing support. Yet the tool has been important to widen access to healthcare and to assisted devices and rehabilitation for persons with disabilities. So yes, this has been proved also in multiple studies. and requires, of course, to be strengthened and reinforcement, as it has been said, but it presents also some interesting elements that can make it a good case study in the region. The second intervention in the panel was from Ms. Phoebe Niyagudi, Deputy Director for Social Development of the Ministry of Labour and Social Protection in Kenya, which first of all reminded how Kenya committed at the 2018 Global Disability Forum Summit in London to develop an assistive technology policy that would regularize and reinforce standards for development and importation of assisting devices. This policy was covered by the 2003 National Development Fund for Persons with Disability, which counts on approximately 364,000 US dollars. Another source of support to assistive technology and devices in Kenya is the National Fund for the Disabled of Kenya, which assists over 4,000 individuals and approximately 200 institutions with grants up to approximately 2,800 US dollars. She eventually also mentioned 4 key policy interventions. The Assistive Technology Hub, which coordinates the establishment of an innovation ecosystem dedicated to the continued creation of goods and services for persons with disability, and AT Policy, Assistive Technology Policy, which aimed at training staff for effective leadership and governance, thus covering all aspects on assistive devices and technology in the country. Policies which are coupled by the support needs service and WHO rapid assistive technology assessment, which are aimed, of course, at understanding needs in terms of devices and technology, which should feed the policies and initiatives that have been previously mentioned. And I move on to panel 4 because in that case, yes, I was supposed to be the moderator or rapporteur. So again, it's me just delivering a very brief recall of the main points touched by the speakers. Panel number 4 was pivoted around the topic of social protection and access to community support, education, and livelihood. Unfortunately, we also missed one presentation here. Well, actually, also the introduction by Ms. Atuma Gaku and the intervention from Ms. Secretary General of National Council of Persons with Disability of Sudan, Riyad Mustafa, who both had some tech issues. That's a world we live in nowadays, and unfortunately, these things happen, but we count nonetheless on 2 very interesting interventions. One from Mr. Luis Lechiguero from the EU delegation to Ethiopia, who widened a little bit the view on the topic by providing an overview of the situation in Ethiopia, the second second most populated country in Africa, having no clear data on persons with disability, a matter that have been discussed multiple times during the seminars and today as well. And he referred to Ethiopia as a major economic player with enormous infrastructural and economic changes going on, coming, however, at a high human price, with only 2% of the population benefiting of pension schemes in the country, with 43% lacking of basic education, and with an extremely low poverty line. Social protection becomes then an essential part of Ethiopia's life. And the main systems were put in place in 2014 with the support of international donors under the umbrella of the so-called PSNP program for safety net plans, which covers approximately 80 million people, and whose 5th phase was launched the day before yesterday. So entering into a new phase where also the consideration of the specific needs of persons with disabilities will be reinforced. He also claimed and stated the importance of being assertive and uncompromising with regards to the inclusion of persons with disabilities in such programs. And he referred to the importance of the current programming phase, preparation of the programming phase of the European Union, which is currently under preparation, as I said, and which will count on approximately 1 billion euros, 40% of which will be addressed to social protection measures. And last but not least, we enjoyed the presentation of Mr. Graciao Langa from UNICEF Mozambique, who began by introducing the new advancements that the country is taking into including persons with disabilities in social assistance and inclusion programs, since their data collection processes were not the most adequate, and also because there was a recognition of low coverage of persons with disabilities in said programs. In these, in particular, there was a request in the analysis was a request to adjust the basic social subsidy by adding to it disability and child grants alongside the already existing elderly grant, as well as to prepare a new program called Process to respond to social risk and promote access to basic social services, family care, and community-based rehabilitation. In this, UNICEF has a major role in all contribution to inclusive social protection, which has also been recalled by by Deputy Director Van der Wiel in her allocution earlier today. Mr. Langa referred to some of the main intervention of UNICEF, such as the support and design and implementation of the child grant and case management covering persons with disability, revision of operational manual covering all new subsidies, one that I was mentioning before, children, persons with disabilities, besides the elderly, design of operational guidelines, identification tools of persons with disabilities, and specifically support to the design of the Process program and through need assessment, task review, consultation with policymakers and person with disabilities themselves, and ending up also with more cross-cutting support to capacity building to relevant government stakeholders and social service staff, development of a communication package to increase outreach, and finally, last but not least, a specific support for COVID-19 response. So again, some interesting practices that could be taken into consideration by other players in the continent. This will be it, and this will end the session of the presentation of the main highlights of yesterday's session. Thank you, Luis, that you're making a correction to the figures that I mentioned in the chat box. My apologies for the misunderstanding. Yes, I also take the advantage to reply to some of the questions that have been asked into the chat box. Yes, the materials will be made available at a later stage once all the reports of the conference will be ready and will be made available to all the participants and registered participants to this conference. So thank you for your patience in waiting for it. I will end this session here. We're already a little bit late, so with no further ado, I would leave the floor to the colleagues from the African Disability Forum and President Maiga and the colleagues from IDA for the presentation of the call for action on inclusive social protection in Africa. Take advantage just to thank everybody for your participation, every member of the team for contributing to the success of this initiative, and to the interpreters and captioners for their great work. Thank you, and Mr. President Maiga, je vous passe la parole. Merci beaucoup à toutes et à tous.
Allô?
Oui, on vous entend, monsieur.
Yes, we can hear you. Yeah? Yeah, Chairman, we can hear you. You have the floor now.
Allô? Allô?
Ah, oui, on vous entend bien, monsieur.
Yes, we can hear you. You have the floor. Hello, good morning. Thank you very much. I don't know if you can hear me correctly. The interpreters apologize, but there is some feedback on the line. But thank you very much for being with us in these 2 days to exchange information on social protection and the health crisis and the challenges that persons with disabilities are facing. And we have searched for solutions and strategies. Those are the things that we've discussed in the past 2 days. On another level, we have the forum, the African Disability Forum and other organizations, African organizations that are working together. And in these days, we have worked, especially during the second half of last year and this year, organizing regional workshops on every different country in order to reflect upon all the issues and concerns that have been discussed in these last 2 days. We have very deep conversations to try to find out the strategies that we need to set up in Africa so that we can obtain some results. And so that persons with disability in Africa cannot be limited to read some guidelines, but so that these guidelines are implemented. And to do that, we have made a video that I invite you to see, where people with disabilities themselves talk about their needs. This is a video made by people with disabilities calling for action so that we can start working. And I invite you to take a look at the video. Please pay attention to this video, because this video is an actual call to action so that we can approach our technical advisors, our donors, our friends.
Nous, organisation de personnes handicapées de la région africaine, demandons aux nations africaines, aux partenaires techniques et financiers, aux agences de développement de reconnaître l'impact que la marginalisation
We, the Organization of People with Disabilities, we ask you to acknowledge the impact that marginalization can have in these people, taking into consideration the cost for maintaining the livelihoods of people with disabilities. We apologize, but we cannot hear the video.
Afin de permettre l'inclusion et la participation pleine et effective des personnes handicapées et leurs familles.
Garantit la réactivité
with the purpose of supporting the livelihoods of people with disabilities, including women and children with disability, elder people with disabilities, and adults with disabilities with high support requirements, and in humanitarian emergencies. We apologize, but we cannot hear the video.
Sont appelés à envisager des systèmes de protection sociale qui répondent aux exigences.
We ask them to get social protection systems that respond to the demands and that provide a combination of universal transactions and that will provide important concessions to the communities. We try to help people with disabilities in order to empower them so that they can get access to jobs and income, taking into consideration their health requirements of persons with disabilities, including rehabilitation services and assistive devices.
Au service de support.
We ensure access to support services across the life cycle and especially during situations of crisis.
Ces services doivent être adaptés.
Those services should be disability responsive, gender and age sensitive. Support access to early childhood development and education through a combination of schemes to support early detection, intervention, education, and coverage of disability-related costs. Geared towards community-based and inclusiveness in the community, identification of beneficiaries in conformity with CRPD. We need to support all people with disability, respecting the specificity of the African context. In order to achieve such an inclusive system, states and other stakeholders are invited to act to the maximum resources at their disposal.
Y compris avec les financements provenant de la coopération internationale.
Consulter et faire participer étroitement les personnes handicapées et les organisations qui représentent les enfants handicapés dans la conception,
including children with disabilities through the representative organization and evaluation of social protection schemes. Social protection is key for the right of inclusion and participation of persons with disabilities. Social protection is key for the right of inclusion and participation of persons with disabilities. Social protection is key for the right of inclusion and participation of the persons with disabilities.
Social protection are key for our right of inclusion and participation.
Okay, thank you very much for this video. Thank you, Gina, for putting it up, and thank you in particular to the colleagues of ADF and IDA for working for the preparation of this video. It's absolutely brilliant and spot on. Just ask, je demande seulement à Monsieur le Président Maïga.
And now I would like to give the floor to the President Maïga, and maybe he would like to take the floor again in order to close the session, to say some final words, and that will be all. So without further ado, I'm going to give you again the floor so that you can close the conference. So I think that he's set up already back to the workshop.
All right, thank you. Thank you, Chora.
From either side, I would like to say that it was a great pleasure being with you all, and thank you to all partners and to your amazing moderation. Thank you, everyone.
Thank you, Chora. Thank you, Ida. Thank you, the African Disability Forum. Thanks to ILO. Thanks to UNICEF. Thanks to the European Union who supports Bridging the Gap, and to all the consortium members. Thanks to all the speakers and the participants to this conference. There's nothing more to add, I believe, from my side. All materials, including, of course, first and foremost, I would say the call for action will be made available online for the purpose of dissemination and knowledge sharing. Thank you again for being part of this conference, Social Protection in Africa, a New Path Towards Inclusion. Stay safe, everyone. Take care and see you soon, hopefully. Thank you again.